little bit of information here on a few topics we've been receiving questions about in recent weeks. So we do have a couple of interpretation options lined up for you here and available on today's press conference. We have a Spanish language interpretation channel that you can find along the bottom of the Zoom console. And we do have an American Sign Language interpreter who will be pinned on the screen at all times, so you can access those interpretation options as needed. That gray slider bar in the middle of the screen can be used to customize your view. And please do email us at media_info@state.co.us for anything that is not covered on today's press conference. This afternoon, we have Dr. Rachel Herlihy, our state epidemiologist, Heather Roth, our immunization branch chief, and Dr. Emily Travanti, our state lab director. We'll get things started with Dr. Herlihy.
Great, thank you so much, Brian. Good afternoon to all of you. Thank you for joining us. As Brian said, I'd like to give you a quick update on our overall epidemiologic trends here in Colorado, and then spend a little bit of time talking about the BA.2 Omicron subvariant and what we know about it so far and what it might mean for Colorado. But the good news continues to be that Colorado continues to have very low case rates at this point. You can see in this figure here that our 7-day moving average number of cases right now is 294. Again, very low levels, some of the lowest levels really that we've seen since the early fall of 2020. So great news here, certainly that we continue to see low levels of transmission. Next slide, please. But one of the sources of data that we are tracking closely right now is our percent positivity data. As we've talked about for many, many months now, percent positivity data is another great source of information for us to understand overall trends in the state. And we often see that trend changes are perhaps first seen in our percent positivity data. And so if you look at this figure, you'll see that our 7-day moving average percent positivity value right now is 3.3%. But that is a little bit up from several days ago. So we're watching this closely. I think it's too early right now to know if this is a true change in trajectory or a trend. This could potentially signal that we are going to see an increase in cases that could potentially be associated with the BA.2 variant. We know that that has occurred in other locations. But at this point, again, really too soon to know if this is a true trend or just some variability in the data at this point, but something that we will be watching closely over the next couple of days. Next slide, please. Moving on to our hospitalization data. You'll see as on the far right end of this figure, our hospitalization number right now. So the number of Coloradans currently hospitalized is 135. You'll see that that value was from March 22nd. So just a reminder that these are data that are now being updated on a weekly basis, no longer on a daily basis. There are other types of hospitalization data on our website that continue to be updated on a daily basis, but this overall figure has now translated or been moved to a weekly update situation. Next slide, please. Moving on to the Omicron subvariant BA.2. So at this point, we are seeing about 21% of the specimens that are being sequenced here in Colorado appear to be this subvariant BA.2 that has been increasing over the last several weeks. That is in comparison to about 35% in the US right now. Also, those trends are increasing overall in the US right now. And this data comes to us from CDC's Nowcast tool on their website, the CDC COVID data tracker. And you'll see that this is reported here as an estimated proportion. So this is modeling type data, what CDC estimates is circulating in the state right now. Based on some of our Colorado data here, we are detecting BA.2 right now in about half of our wastewater utilities across the state. So what we know about BA.2 so far is that it does appear to be associated with a surge in cases that have been occurring in Europe, several European countries, and now is causing really more than 50% of cases in some of those European countries. There's also some locations on the East Coast in the US where it is causing more than 50% of cases. It does appear to be more transmissible than the original Omicron lineage, and that appears to be associated with potentially this increase in cases or new surges that have been seen in some European countries. Does not appear to be any more severe than the original Omicron lineage, and does not appear to cause increased immune system evasion from prior infection or vaccination. Next slide, please. And with that, I'll turn it over to Dr. Travanti.
Thank you, Dr. Herlihy. So as Dr. Herlihy was indicating, we are still seeing some level of COVID in our communities, and we'd like to remind everyone right now that we do have plenty of testing that continues to be available across the entire state. You can see on this map here that the testing distribution covers most of the state, and that the yellow markers are where you can access our PCR testing with about 2-day turnaround time. And the blue markers show where you can pick up rapid tests, which are great to have on hand. We're currently only using about 5% of our testing capacity, so many tests are available across the state. We are also looking at moving testing into healthcare systems. Being able to access your healthcare, your test in a traditional healthcare setting, including doctors and pharmacies, will allow for increased continuity of care. And we also would like to highlight that the federal at-home testing program is also available. If you're looking to have access to testing, particularly right now after spring travel, you can access testing on our website at covid19.colorado.gov/testing. Next slide, please. In addition to testing, we continue to use wastewater to monitor COVID-19 across the state. Wastewater provides an excellent way to look at the community level of COVID around the state and allows looking at test results without having to have people access healthcare testing. We currently have 47 utilities participating in our testing. You can monitor the wastewater results on our website at the covid19.colorado.gov site under COVID-19 monitoring in wastewater. And now I'd like to turn it over to Heather Roth.
Thank you. So on the vaccine front, we continue to get doses into arms across the state. A couple of successes that we like to celebrate today. One, we finally surpassed the 2 million mark for people who have actually been boosted across Colorado. And secondly, we're finally under 1 million people who remain unvaccinated. So people are continuing to go out both for their primary series doses and their booster doses. But of note, we have about 30% of our eligible population who have completed their primary series and not yet been boosted. So just a reminder, booster doses are available at more than 1,900 provider locations across the state and are very helpful in preventing hospitalization and death. A lot of movement kind of at the federal level in terms of what we're calling fourth doses or maybe second boosters. Both Moderna and Pfizer have submitted documentation to the FDA to authorize a fourth dose for different age groups. So Pfizer is trying to get authorization for adults 65 and older, and Moderna is seeking authorization for adults 18 and older. Of note, FDA and CDC are expected to authorize this second booster dose as soon as tomorrow, probably for adults 50 and older. We do anticipate this being kind of an optional recommendation, not a full official recommendation. So anticipate people kind of having conversations with their healthcare providers and making a decision to get that second booster dose based on their current risk factors, any comorbidities, and their age. Next slide. So at the same time that we're kind of looking forward to and planning for second booster doses, we're also continuing to plan and anticipate COVID-19 vaccines for younger children, so children younger than age 5. Pfizer and Moderna are both expected to submit data to the FDA soon. Soon is qualified, it's probably in April for COVID vaccines. So Pfizer would be for children 6 months through 4 years of age, and Moderna would be for children 6 months through 5 years of age. And then a final note here is that FDA has set a meeting of their advisory committee on April 6th, really as an open session to talk about considerations for future recommended doses, as well as the process for selecting strains for new COVID-19 vaccines. CDC will be at that meeting, as will the National Institutes of Health, and really kind of having an open discussion around what the future for vaccine development and rollout looks like. And I think that's it on the vaccine front.
Great. Thank you, Dr. Herlihy, Dr. Travanti, and Heather Roth for your presentation today. We're going to move into the media Q&A portion of this afternoon's press conference. A couple of notes here. We'll use that raise hand function located along the Zoom console. start with first questions first, please. We'll have, if we have time towards the end, we can come back for some follow-ups or second questions. Please state your name and outlet before asking your question. And for anything that wasn't covered on today's conversation, please email us at media_info@state.co.us, and we'll get back to you as soon as we can. Let's go ahead and get things started with Sarah Flower. Go ahead, Sarah.
Hi, good afternoon. Thanks for taking our questions today. Sarah Flower with KSUT Tribal Radio. Right now, the New York Times is reporting that Colorado is the second highest state in the nation for COVID-19 cases. Any thoughts on that and why Colorado is so high in comparison to the rest of the country? Thank you.
Yeah, this is Rachel. I can take that question. So we are working closely with CDC to address some issues with data that is shown on the CDC website right now. So the way that Colorado data is being displayed on the CDC website is unfortunately including backfill cases. When CDC puts state level data on their website, they pull that data off of state websites, but unfortunately, the way that they do that includes backfilled cases and suggests they are current cases. And so there's some challenges right now with how Colorado data is being shown as we continue to work through a backlog of cases from the Omicron surge. So unfortunately, the data that's on CDC's website, which then I think goes on to be the source of information for some media sites, is not completely accurate right now. Again, we're working closely with CDC to correct that data. We're sending them files to get that data updated to accurate numbers. So my recommendation would be to look at our state website as really the most accurate picture of COVID-19 in Colorado. Right.
All right, let's go to Meg Wingerter. Go ahead, Meg.
Hello, this is Meg Wingerter from the Denver Post. With some of the federal funding lapsing or running out in the near, what is the state doing to try to avoid disruption in terms of all of the things that federal funding was paying for?
I can take, at least from a vaccine perspective, that don't actually anticipate the funding concerns that are currently present impact the vaccines that we currently have available. So that includes everything from, primary series and booster doses, but also the anticipated doses needed for kids under 5, where I think we'll run into some issues if funding is not secured, is this kind of larger recommendation for, all Coloradans, all Americans to receive what basically would be a 4th dose or second booster dose.
All right, let's go to John Daly. Go ahead, John.
Hi, thanks for taking our questions. John Daly, CPR News. Just wondering, with the rise in positivity, any other metrics that you'll be looking at closely or that have shown any signs of a spike besides that at this point? Any other signs of a potential another wave coming?
Sure, that's a great question. So in addition to percent positivity data, we will be looking closely at our case data and then, of course, our hospitalization data. At this point, I think the case numbers are quite low, and it can be challenging to interpret case numbers when the numbers are so low, because those day-to-day changes with small numbers can represent a fair bit of variability in the data. So there can be some volatility from day-to-day data changes when the numbers are so low. They're a little less stable. So I think what we would want to see in the data to clearly understand what Colorado's trends are in cases would be multiple days of a changing trend, whether that's a continued declining trend, which is of course what we'd all like to see, a plateau, or potentially an increasing trend. So what I'm going to be looking for over the next couple of days is I will be closely watching that percent positivity value to see if that continues to go up. And then if we start to see any changes in cases, an increase in cases, that could potentially be associated with another wave of illness. At this point, we're also, of course, looking to the East Coast, where we know there is more BA.2 circulating than there is here in Colorado, and of course, European countries that have much more BA.2 circulating than we have here to really try and understand what these trends might mean for us.
All right, let's go to Kathy Walker. Kathy, are you there? You might be muted. All right, if you'd like to raise your hand again, Kathy, we can come back to you. Let's go ahead to Meg Wingberger here for a follow-up.
Hello again. I wanted to ask about with BA.2 starting to rise, you said about 20% caused by that. Is the state making any changes in terms of how you are distributing the monoclonals or recommending that they be used? Because I believe they recently said one of the remaining ones was not doing so well against BA.2. Thank you.
Thanks. So there is some limited data to suggest that one of the monoclonal antibody therapies that's in use right now, monoclonal antibody therapy known as sotrovimab, potentially has some decreased effectiveness against the BA.2 subvariant. And so there are certain locations in the US, I mentioned the East Coast, where there is a higher proportion of BA.2, where the federal government has recommended that other treatments be used in preference over sotrovimab. At this point, the proportions of BA.2 continue to be lower here in Colorado, but we'll certainly be looking to the federal government for guidance on whether or not we need to change recommendations for treatment here.
Right, let's go back to Kathy Walker. Go ahead, Kathy.
Thank you. Sorry about that. Heather, first off, proper way to say your last name. I've heard it pronounced different ways today.
Yeah, thank you. It's Roth with a long O.
Thank you very much. My real substantive question here is, I know many neighboring states are now closing testing sites, and what is really kind of the messaging that CDPHE wants to get out about testing and where to find it? Many of us obviously are doing it at home now. Should we be reporting those at-home tests to the state? Just what's the overall message about testing?
So I think the most important overall message that we have about testing is that if you have symptoms, that you should access testing. We are continuing to have PCR testing available across the state. We're looking, though, at the data around utilization of these testing sites, and we have seen some natural attrition in some of these sites, and so that we can look to close a few of them based on their decreased demand. We also have community-based sites where you can pick up these over-the-counter tests, as well as access, remember to access that federal rapid at-home testing program. The president recently announced that Americans can now reorder 4 more of those, and they're great to have on hand before you maybe have symptoms. So you have a stash of those, maybe in the drawer waiting for you to need them. And we continue to look at what is our plan for ensuring that we have addressing testing needs as long as we have COVID here with us in the community. And we will continue to look at utilization, as well as trying to really understand how we can best integrate the new test to treat programs from the federal government into the entire healthcare system. Here, those will be available in pharmacies. And if you test positive, you can get immediate access to COVID-19 treatments.
All right, we'll go ahead and take one more question from Alex Rose from KDVR in the chat. Dr. Hurley, if perhaps you can shed a little bit of light on the difference between the CDC estimate of BA.2 prevalence here in the Colorado region and what our Sentinel surveillance dashboard shows based on the limited number of samples there.
Yes. So the numbers that I mentioned during the media avail today are numbers that come from CDC's Nowcast website. It's on their CDC COVID data tracker site. And those are really model data or estimates of the proportion of variants that are circulating. And they're really meant to represent what is circulating currently, most recently, before those data are currently available. And what is available on our website for variant proportions is a sample of specimens from across the state. It's meant to be a representative sample from various regions across the state. One of the things that you probably saw on our update last week is that variant proportion for BA.2 went down to 0. That's probably just a sample size issue. the total number of samples that were represented in that most recent bar on that data was just 50. Again, and so that's really part of the reason why we look at multiple sources of information. We look at that CDC modeling data plus our own dashboard to really try and understand what level of different variants or subvariants are circulating at any given time. We expect that as we see additional numbers of specimens sequenced last week and we update our dashboard this week, that data will probably see an increased proportion of BA.2.
All right, thank you everyone for joining, and thank you to our presenters this afternoon. If you have any questions that you think up later or that we weren't able to get to today, please email us at media_info@state.co.us. Thanks again for joining us and have a great rest of your afternoon.